Hi, my name is Chloe and this is my intradermal injection video. I am in course BSN 225 section 9. So our supplies today are our patient, our injection site, a pair of clean gloves, our alcohol swabs, gauze, our medication, and our syringe. So the one required for this video, I was not given in my supplies kit. So I emailed my teacher asking if it was okay that I used the tuberculin safety syringe. That's what I'm going to be using today. But if I was in a real hospital setting, then I'd make sure that I have the correct one, which would be a 29 to 30 gauge with a 1.5 inch needle. Okay, so that's what we're going to be using today. So the first thing that we would do is we would gather our supplies, which we have done. Next, we would go over the 6 rights of medication, which are right patient, right drug, right dose, route, time, and documentation. Once we do that, we're going to go ahead and go over the patient's EHR to go ahead and look at the orders from the doctor. Okay, once we do that, we're going to go ahead and calculate the medication. That's right here. So the medication today is going to be the tuberculin 0.1 milliliters, also known as Mano2. That's the medication. So we'll want to make sure that we calculate that first before going into the patient's room, okay? So now that we have that information, we can go ahead and go into the patient's room with all of our supplies. Okay, so I'm going to go ahead and knock on the door. Knock, knock. Hello, Miss Smith. I'm going to be your nurse today. I'm going to go ahead and close the curtain for privacy, wash my hands, and I would then evaluate the room, see if there's any patient visitors or family. If there is, we want to make sure that we check with the patient to make sure that they're okay with staying, or if they need to leave so that we can stay in regulation with the HIPAA and we don't, regulate those at all. So since there's no family, I'm going to go ahead and move forward. Hello, Miss Smith. So I'm Chloe. I'm going to be your nurse today. Can you please tell me your full name and date of birth? Perfect. So I would then use this time to identify the second verification for their identification, which is to compare the information that they gave me to the order from the doctor. Miss Smith, do you have any questions for me right now? No? How are you feeling? Good. Okay. So once we go ahead and do that, I'm going to go ahead and make sure that the patient has no allergies. Ms. Smith, do you have any allergies that we need to be aware of? To any medications, any food, any seasonal allergies? Okay, great. So today we are going to be administering a medication because the doctor has provided an order for us to give it to you, okay? So we're going to be doing an intradermal medication, so we will inject it into your skin. This medication is tuberculin, and it's 0.1 milliliters, and it is a protein purified it's a protein purified derogative. The action of this medication is that it's an antigen substance. So this is what allows us to see if you're negative or positive for tuberculosis, okay? So we are going to be doing an injection, like I said, into your skin. It's just going into the dermis, which is right below your skin, okay? So not too deep. There are possible side effects, which could be a burning sensation, stinging, headache, and then there could also be some adverse side effects, which could be swelling, vomiting, some numbness in the arms or hands, and then sometimes in some cases bleeding could occur. Okay, do you have any questions at the moment? No? Okay, great. So once we go over the medication, then we're ready to go. I'm going to go ahead and confirm just that I have the right medication, the right dosage, and just make sure that we're ready to move forward, okay? So I would then wash my hands and put on a pair of clean gloves. Okay, so since the medication is new, we would go ahead and open, and then we would take an alcohol swab. This is just going to be my little trash right here. And we would clean the surface. Okay. Once we do that, then we're ready to get our medication ready. So the way that we hold it is with our 4 fingers with our thumb pointing up. With it pointing up, we're going to go ahead and fill it with air for the correct dosage that we're going to be giving. So in this case, we're doing 0.1 milliliters. So I'm going to fill it with air to the 0.1. Okay, right there. Now we're going to go ahead and get the medication, okay? So I'm going to take off the cap. And I'm going to inject it into this medication. Now I'm going to inject the air into the vial. I'm sorry, I had an itch, but normally I would have to go wash my hands. So we'll go ahead and inject it. Once it's injected, I'm going to go ahead and flip it upside down. And I'm going to fill the syringe with the proper amount of medication per the doctor's order, which is 0.1 milliliters. Okay, now I will tap to make sure that there's no bubbles. If there was bubbles, I would go ahead and inject the medication back into the vial and redo it, just because we don't want any bubbles in there. Okay, now we will go ahead and tip it over. Now taking it out, I am going to go ahead and put the cap back on, just like that. Here is our 0.1 milliliters of medication. So now that that is ready, now we're going to go ahead and prepare the site for the injection, okay? Ms. Smith, I'm going to go ahead and inspect the area and make sure that I'm finding the correct place to inject the medication, okay? So, I'm going to sit up. So in this case, this would be her hand and this would be her elbow. So we want to go ahead and inspect. This is a good time that if there's any redness or anything that we need to be aware of, any skin lesions, that we can take note of it and chart it. So this would be a good time to do that. And we're gonna go ahead and look for the anti-cubital is where we're gonna be going ahead and injecting. So once I find it, I will get another alcohol swab and I will clean the area going from inner to outer. And we want to let it dry by air drying. We do not want to blow or wave our hand or anything to help it dry, okay? So we're gonna let it air dry. So, okay, it's about dry. So I'm gonna go ahead and get the medication. I'm gonna take off the cap. Holding it like a pencil, I'm going to take my non-dominant hand and pull the skin to help with the injection. And I'm going to insert it at a 5 to 15 degree angle. And we're just gonna go 3 millimeters in, just into the intradermal, okay? Okay, Miss Smith, I'm about to inject it, okay? Let me know if you have any pain or burning or anything, okay? Okay, I feel tension now, so we're good. I'm gonna go ahead and slowly inject it. I'm not actually injecting it just because I don't want it to get inside of the skin, but we would slowly inject it. And we also want to make note that with the TB test, we'll sometimes see, well, we always will see a bubble, almost like a mosquito bite. And that's what shows us that the medication is in. Okay, now we're going to slowly remove it. And we will dispose of this into the Sharps Hazard container bin. Okay, and I will also put on the gauze. Okay. Sometimes in the case, if they needed a Band-Aid, then we would do that, but we're not going to do that in this case. Okay, Miss Smith, everything looks good. How are you feeling? Good? Okay, great. I would then clean up my area, make sure the patient's comfortable, dispose of my gloves, and chart, well, wash my hands, then chart. Thank you.